Well, it's time for Tucker's next treatment, and he lives a tough life. Tucker, do you want your next chemotherapy treatment? Would you like to get off the couch with your friend Reggie in the nice living room we keep for guests that we don't want a lot of dog hair on? You think you guys can deal with that? Well, let's go, Tucker. Come on. Come on, Tucker. Yeah, you want your chemotherapy treatment? You're looking pretty good, dude. Well, I put him on thyroid, and he's lean and mean now. I probably should have done the thyroid a long time ago, but he was only low normal, which means his thyroid hormone wasn't really on the low side. It was just low normal. But when we put him on him, he just got lean and mean, and he of course, when he sits there, he always wants me to. You want me to give you a massage? Okay. Give you a massage before you go, sir. How's that? Do you like that? He loves his massages. Well, we'll just massage his foot before he goes and gets his chemotherapy. Let's go get in the car. Go get in the car. Come on. Yeah, over the side. Here we go, buddy. Here we go. Yeah, you look good. Well, everybody, it's been about 3 months, and he's got anywhere from 3 months to 9 months to live. So we're hoping that he has more on the 9-month side. Maybe there'll be a miracle. So we're gonna weigh Tucker to see if his weight is well, what his weight is. So come on, you gotta go weigh yourself. He won't go anywhere without me. So we're gonna weigh him and see what he is today. What's your weight, Tucker? Oh, you're just a poor boy.
82 pounds.
82. So we're gonna take blood from Tucker because we need to see, make sure his BUN and his white blood cell count and his kidneys and liver okay, and red blood cell and white blood cell count is okay. So we're taking it right from the jugular vein on Tucker. Look, isn't he a good patient? And Kim's gonna put it in the appropriate vials to do the test. And here comes Tucker's lab work. What do you think, Tucker? Let's see if you're healthy enough for your treatment. So we're going to give him Serenia before the chemotherapy, so that he doesn't get as nauseous or have. Does that work? So Tucker, this is your lab work. You're slightly anemic, and I'm off today, so that's why I don't have veterinary apparel on, but you recognize me, right? Didn't shave, was working out this morning. It's a new look. He's a little anemic, but he was anemic when he had the splenectomy. But he's making all kinds of new blood cells. That's what reticulocytes mean. And so, even though he's anemic, we'll try to give him the chemotherapy and see how his body reacts this next time. The really nice thing is his liver and kidneys are working great. His filtering organ and his organs of detoxification are working great. So your organs are fine. Yeah, I know. You're glad. Tucker weighs about 82 pounds, and he's 37 kilograms. And we use doxorubicin at 30 milligrams per meter squared. So Tucker is about 1.1 meters squared, according to a conversion chart. That's when we convert kilograms to meters squared. And if you figure that out, 30 times 1.1 meters squared is 33 meters squared. And 33 milligrams. And if you divide that by the concentration in the bottle, 2 milligrams per mil, then you get 16.5 milligrams. So through those calculations, we want 16.5 mLs, and you can tell I don't have my veterinary garb on, but I do have gloves on. And we're going to draw out 16.5 mLs of this pretty chemotherapy toxic substance. So I'm going to go up to 16. Don't want any more than that because we don't want to put any more toxic stuff in Tucker's body than we have to. And then we're going to take this amount and we're going to put it into the bag and make the bag a pretty toxic color. So why we dilute out these drugs is they're they're toxic, and if they got in full strength concentration, they stress the organs and tissues a lot more. So poor Tucker's a patient now. He's getting his arm all prepped up for a catheter. Of course, we sterilize it and then we'll put in the catheter and tape it in. So, because it's real important to get a really good catheter in, especially for chemotherapy, because the solution itself is so irritating. So Kim fills the vein, and then she goes in with her expertly dexterous hands, and she puts it right in the vein.
Yeah,
there's a valve there.
Uh-huh. And now it's blowing. I'll have to go up.
Sometimes the catheter doesn't go right in, so we put a little bandage on the venipuncture that we had that didn't work, and we're going to go up a little higher. So I jinx Kim with the camera. She's usually one-shot Kim.
Yeah, it's flowing.
For your legs?
So we're checking to see if
Feel it.
if the catheter's in. The veins aren't as good as they were before. And if you put this much fluid into the vein, you can certainly see it swell up here if it's not in. And we're not seeing any swelling, so we know it's going in. So the tape around the catheter itself holds it in place. And that piece of gauze is from the other, is from the other puncture we did, and we're going to take that off. Have another piece of tape. We tape them in really securely because animals they want to get them out of there as soon as possible. They pull on them and chew on them and lick them and move around, and they're not the easiest on catheters. And then the vet wrap of the day is camouflage. We're going to do a camouflage motif. That's a Christmas motif we've adopted.
It's giraffe print.
It's what?
Giraffe.
Oh, it's giraffe print. I'm sorry.
Safari print.
Well, it's camouflage. Giraffes are camouflaged. So are leopards, and so are. That's camouflage. Okay, giraffe print. And Tucker's just relaxing. He's been a good boy. He's got his catheter in. He's looking at Dad. And he's going, "Do we really need to do all this?" "Yeah, dude. Oh, there probably won't be a miracle, but we know maybe it'll give you a few more months." And that's a good thing, right? Okay, Tucker, you have to be a patient. That's new. You have no couch. You just have a blankie. You have to be a patient. You have to get your IVs, and then we'll see how you react today. Hopefully, the other day you reacted a little bit. You got sore joints, a little diarrhea, vomited a couple times, but we'll see how you react this time. So now Tucker's going to get his chemotherapy over a few hours. We move it, go slowly because it's not as toxic when it goes in slowly. So he's gonna stay here like a good boy and get his chemotherapy, and then I'm gonna come back later and get him. Well, Tucker's sore this morning. He got up in the night. You can see he's panting. He just doesn't feel very good, and his joints are sore, so he doesn't really want to get down off the bed. So he slept last night, and he had some diarrhea yesterday, and I heard him during the night kind of irping like he's kind of has an upset stomach. So chemotherapy makes your joints pretty slow, so he's moving a little slower today. But he's panting because he's just not feeling too good. It could be a sign of nausea. After the chemotherapy, about a day later, Tucker got real sore. Today he won't eat. He had some kind of really loose diarrhea. You can see he's breathing real hard. Nice thing is his color is nice and pink. Even though the blood work showed he's a little anemic. You can see how he's laboring. He just doesn't feel very good. Last night I actually put him in, well, he sleeps with us on occasion in the mornings, but I put him in my bed last night, or put him in our spare bedroom in a big old bed, and I put my arm around him. See how he wanted to puke like that? He's nauseous. So yeah, I know, I'm sure. So he's nauseous from the chemotherapy. I almost was going to take him in the clinic and get him some fluids, but he will drink a little bit, and so even though he's nauseous and doesn't want to eat too much, he drinks. And remember, if your dog's puking or nauseous, you don't want to give him a whole bunch of water. So you want to give him a little bit of water a lot of times daily, because the more you fill the stomach, the more it makes him nauseous and the more makes him want to throw up. Giving him water, as long as he's drinking, he doesn't have to go in for IV fluids. And come on, Tucker, come here, come on, get up. You can see he's pretty sore. When I would pick him up, you can see how he's hanging his head down. He's just weak, and see, he just doesn't, just weak. Now, just a couple of days ago, he was pretty darn happy and healthy and running around. So that's how fast chemotherapy can knock the heck out of you. The people that take it say it's kind of gives you what feels like a real bad flu, and you just get real weak and nauseous and joint sore. So his joints are real sore. He's breathing a little harder. He's irping up and a little nauseous. And when I was feeling his pulse last night, I noticed it went way up. In fact, after I brought him home and in the middle of the night I was feeling his pulse, and I was thinking, should I take him down to the clinic and treat him? But I decided, well, his pulse came down in the middle of the night, and I just was there with him in bed and put my arm around him, my big buddy. So anyway, it's hard to not get a little emotional about it, but I just want to show you guys what a dog goes through when it goes through chemotherapy. So this is his last treatment. I'm not going to put him through this kind of soreness and nausea anymore. And we'll just, I wanted to, the purpose of the chemotherapy is it attacks the rapidly dividing cancer cells. And what it does is those rapidly dividing cells, it keeps them small. So it extends his life, and it might give him 6-7 months. So this is let's see, this September 20th, yeah, that's October, November, December. This is 3 months. So I'm hoping maybe it's a few more months, but we're not going to make him feel like this anymore, right? This is it, buddy. If you could just get through the next few days, then we'll just see how much time you got left, but no more making you miserable. Well, this is Tucker at home. He had a really rough couple days. As you can see, he's still breathing hard. He's finally eating and drinking now. What happened was his gums started getting really pale. In fact, a couple times, they're pinker now, but a couple of times they got really pale, almost whitish, and his heart started beating very rapidly. I felt his pulse, and it was beating really rapidly, and actually one time he fainted and fell. He was very dehydrated, he couldn't eat or drink, so I put an IV catheter in him, just like you saw at the clinic. I did this one at home. As you can see, I still use the beautiful giraffe print, which is very nice. But he's doing better now, but I was worried I was going to lose him. I took him down to the clinic today, and I did blood work, like you saw us do before for him, and he's getting very anemic. His blood count is PCV is only 22%. We don't want it to go much lower than that, because if it goes much lower than that, he'll get very weak. I know. I'm sorry, I'm rubbing that on your head. But also, all his kidney enzymes and liver enzymes and electrolytes are good, but he's very anemic. And you'll see in the x-ray, I'll point out in just a second, his heart looks good. I was worried that his heart was big, and he's starting to have heart failure due to cardiomyopathy, which is one of the side effects of the drug. But it turns out, I think I see, and I'll point out to you, some blood bleeding in the heart sac. That could be due to a tumor in the actual heart, which is common for splenic tumors to metastasize or start out in blood-forming organs like the heart and the spleen. So unfortunately, Tucker's probably got a tumor in his heart. He made it through this chemotherapy. I'm definitely not going to do any more. This was really hard on him. I thought I was going to lose him yesterday, huh? But no, you got another day, big guy. Pretty good. What are you going to do with it today? I know, sleep, eat, look at people. That's what they do. But anyway, just want to give you a little update on what happened today. So I'm going to take the catheter out, and then he's eating, so that's good. And we're going to check his blood again in a few weeks to see if his blood count goes up. So let's hope for the best. So what you see if you look at the heart there, you'll see a little line in front of it, a little black shadow and then a gray line, and that's blood in the sac of the heart. And that's probably bleeding from the tumor up near the right atrium. So that shows us is the tumor's probably in Tucker's heart, or on the lining of the heart, and is bleeding into his heart sac, and that might have been causing, just the tumor being there can cause some irregularities in the heart rhythm and make it not beat right, and maybe that's why he had some fainting episodes yesterday. So we hope that the tumor will shrink a little bit with the chemotherapy, but that just shows you that we're not going to cure him, as I knew practically that he's only got months to live, but thank God he's better today than he was the last couple of days, because I was thinking if he didn't get any better than that, it's not worth it. And that's always the question I get is, Dr. Martinez, when do you know it's time? Well, when the animal looks pretty darn miserable and there's not going to be better, then it's probably time. But Tucker got a reprieve, and I just want to give you an update. Well, have a good day.